Hello, I'm Ruth Crowder, the Chief Allied Health Professions Advisor for Welsh Government. I'm absolutely delighted to have this opportunity to be involved with the first All Wales Allied Health Professions Festival of Innovation 2020. It's promising to be a really exciting few days as we share some of the innovative and transformative work that's being done amongst the AHP professions. The work that you've undertaken over many years, but particularly over the challenges of the last 6 months, have been quite phenomenal. It's really lovely to have this opportunity for you to be able to share learning and start to drive that improvement and change that we all believe so passionately in, so that we can improve outcomes and experience and the quality of what it is that we are delivering for the people of Wales. So we've got 3 days lined up, and the first day today aligns with National Allied Health Professions Day, a really exciting day where today we'll be focusing on celebrating innovation and your response to COVID in really creative ways. Tomorrow, an equally exciting programme focused on leadership, compassionate leadership, and how we start to drive change and improvement in our services. And then the final day has the exciting focus on celebrating our achievements and culminates in the ceremony of the Advancing Healthcare Awards, and I am looking forward to that with huge excitement and anticipation. This time last year, Welsh Government published the Allied Health Professions Framework Looking Forward Together. It has a really clear focus on what it is we as allied health professionals need to be doing in order to drive that change and enable our citizens to achieve the outcomes that matter to them and experience the highest quality of care. The other part of the purpose of that document is to enable allied health professionals collectively and individually to embed value-based health and care, to apply your skills and experience and professional values in leading and delivering evidence-based care that improves the people we work with. And I'm really thrilled that during this 3 days we have a link, an association with the Value in Health conference that is also underway, and you'll find information about that in the programme. So there's 6 real principles to what it is we want to achieve in the Allied Health Professions Framework. First, allied health professionals are outstanding and need to do even more to inspire and enable people to lead healthier lives, to have that focus on prevention and health improvement. We need to be building resilience in the population and focusing our skills on how we can help people to manage for themselves and to be equal partners, if not in control of their own care. The third principle is around accessibility and responsiveness. How are we responding to people's needs? How are we working with them when they ask us something? How do they reach us? When do they reach us? Is it early in their pathway of care, or is it far too late for us to be as effective as we could be? Are we only providing our services at times that suit us and not times that suit the people who need our intervention? We know and recognise that allied health professionals have not traditionally had a strong identity and presence. And so the 4th and 5th principles around creating that strong identity collectively as allied health professionals, as well as making sure that we promote that individual special contribution that each of the 13 professions in this group in Wales has. We also need to ensure that we have visible, strong, transformational leadership to help us achieve that. And the 6th principle then is about working at the top of our professional licence, not sitting in our comfort zone, but constantly pushing, finding new evidence, evaluating everything that we do, stretching ourselves and ensuring that we deliver the highest quality of service and enable people to achieve their outcomes. So we have a whole programme of work being established to help us achieve that. In the meantime, of course, we have had a very interesting 6 months with the COVID pandemic, and I'm aware of how wonderfully each and every one of you has stepped up to really create services that are needed in a worldwide pandemic. Part of the work that you've stepped up to do has been to support me and Welsh Government in delivering a rehabilitation framework for Wales. That framework, with its evidence-based underpinning guidance, its evaluation tool to help you evaluate your rehabilitation services, and the modelling resource, which is there to help you start to calculate, identify the demand and capacity that you have in order to meet the increased demand as a result of this pandemic, is all there on our Welsh Government pages. And I know that many of you are starting to implement, validate and test it. We're also still amending and improving that as you send us further evidence and data about the long-term impacts of COVID-19. So I'm not going to talk much longer. There are much more exciting events and sessions on. I really want to thank you for joining us here in this festival and look forward to a really exciting 3 days, and then to us all taking that back to our services and making a real difference in our everyday practice. Thank you once again. Diolch yn fawr.
Hi, my name is Lisa Love-Gould, and as Chair of the Welsh Allied Health Professionals Committee, I'm delighted that you join us for day one of an exciting 3-day festival. Today we're launching the new name for the committee, the Welsh Allied Health Professions Committee, and it was previously known as the Welsh Therapies Advisory Committee. We feel that the new name better reflects the 13 professions which are represented within the committee, alongside the national leads and the policy officers. The role of the Welsh AHP Committee is to give professional AHP advice to the Welsh ministers, and we are one of 7 committees in Wales which have this advisory function across all health professional groups. As a committee, we can also raise any professional concerns that we feel need the attention of and/or the support of Welsh Government. The Welsh AHP Committee is unusual in that we represent such a wide range of professions within one committee. This can be quite challenging as chair to ensure that advice is coordinated, as it comes from such a diverse pool of perspectives and backgrounds. However, I would argue that this also means that the professional advice that we do give can be relied upon to represent the full range of viewpoints in a truly inclusive way. As AHPs, it's important that you know the committee exists, that you know who your professional representatives are, and that this is your conduit really for getting your voice heard. So please contact us if you'd like to learn more about this. This festival is the COVID response to our usual annual get-together, which we obviously can't do in the same way this year. The purpose of this event is to enable AHPs and other professionals to share, learn, think and reflect in order to improve the services we give to the people. As an operational manager myself, I appreciate how busy everyone is, but I really hope that you can enjoy some live events and some recorded events at more convenient times for you, as we're keen to share good practice and support your professional development. Thank you for registering. I hope you enjoy the festival over the next 3 days, and please don't forget to give us your feedback as well. Enjoy.